Good evening. It is Sunday, March 13th, and thank you for joining me for my Real Talk Live. Um, the, the topic tonight is self-harming behaviors. I couldn't type that topic um, in the title because the word self-harming is negative and it's not allowed in many circumstances. But tonight I'm going to focus on what is the definition of self-harming behaviors, example of self-harming behaviors, the cause, why people self-harm, tips and strategies to intervene or stop, and if you suspect that someone is self-harming, a loved one, a friend, a coworker. So I'm going to be live for approximately 20, 30 minutes, but thank you for joining. This is a very sensitive topic. So what I would say to you is that if you yourself um, is self-harming or you know someone who is, please contact a professional to ask for help. Don't do this on your own because it's very complicated, and I'm going to get into it now. So what is self-harming? It means intentional an intentional act or intentional behaviors to actually harm yourself, so on purpose. um, Most people talk about self-harming, like cutting is a lot of what people think about when we talk about self-harm, but it's more than that. It is cutting, it's burning, it's intentionally putting your skin in hot water, banging or scratching your body in any way, sticking sharp objects into your body, um, and not letting wounds heal. So, like if you have a cut, don't clean it or anything. um, those are physical self-harming behaviors. Then there's mental and emotional self-harming that also exists, which people don't talk about them frequent enough. So um, those are behaviors to intentionally put yourself in harm's way, at risk. So, intentionally dating a toxic person, knowing that sometimes we do these things, it's intentional, but it's tied to a psychological perspective or self view that that's what you deserve. And a lot of victims of domestic violence actually do behave that way, where they put themselves in harm's way. And so nobody intentionally wants to get hurt. They're trying to feel better. And I'm going to talk about the reasons behind self harming, because nobody wants to say, I'm going to hurt myself. There's a very small percentage. There are some, but there's a small percentage of people who intentionally just want to hurt themselves. All the research that I've reviewed over the years, and some of the work I've done, really, it's the word that comes to mind is relief. People that self harm just want to feel better, basically, and they've created these maladaptive behaviors, negative behaviors, to try to feel better from what they're dealing with. And I'm going to review that in a second. So it can be drinking too much till you pass out constantly, and then you don't remember anything that you did. It could be promiscuous sex with strangers. Um, you just meet somebody in a bar and just pick them up. I'm not talking about one night stand. I'm talking about a pattern of behavior. So self harming is a pattern of behavior for you to feel better or attempt to feel better from whatever you're dealing with. And usually self harm is done in secret. It's definitely hidden from family and friends because there's a feeling of shame. Um, and then what I would say to you, it's so again, there's the physical self harming, and then there's the mental, emotional self harming that people can do. Um, Self sabotaging is another way. Like if you ever, if you yourself or someone you know has, I know somebody who would date someone one time and then they're done with them, and a part of the problem is that it's the fear of going to the next step. It's the thoughts that they may not be worthy of love or worthy of relationship or caring, and so that too. if a person does that too much, then that's a form of mental emotional self-harm. And if you have any questions, please ask me, but either here or through my inbox, because the reality is that addiction is self-harming. So drugs and alcohol, um, and so what causes self-harm? Well, a couple things. And on a side note, there's a difference between thinking of harming yourself versus actually doing it. They both need to be addressed. So if you're thinking of self-harming, of cutting, of doing drugs, of putting yourself in harm's way, but you haven't actually done it yet, you can intervene. And I'm going to give you, by the end of this, I'm going to give you some tips and strategies and things you can do to make yourself feel better or to help someone else that you think is harming themselves. So most likely, who is research shows that females, women, girls are more likely to self-harm than boys. Not saying that it doesn't exist, but it does exist. It's like a difference between 17 and 30%. So 17% are boys and 30% are girls. Um, Now, the other thing I would tell you is that this research is based obviously off of studies that were done, um, where it relies on people actually admitting that they actually self-harm or not. And we all know that women are more in tune with their emotions, and boys are taught not to open up emotionally. Like boys, when they're little, are taught you got to be tough. So what? Okay, you fell. Clean yourself off and don't cry. Boys don't cry. That's what boys are taught. So emotionally, they're not in tune with their emotions as much. And thankfully, that is changing and is becoming more normal for guys to express themselves, and it's healthy anyway. Everybody should learn a healthy balance for themselves to express their emotions and feelings. If not, a lot of times people that self-harm actually internalize their feelings and they don't share what's going on with anybody. So um, what are some of the causes? Well, some of the reasons behind why somebody would self-harm is because they're trying to deal with strong emotions like anger or sadness. That's one. Another is to punish themselves for things that they think they've done wrong. Number three, to make themselves feel normal because for some reason they feel different or different from the people around them. Like if somebody gets bullied, they start believing that they're not worthy or they're less than, or they are begin dealing with depression from the PTSD and trauma of bullying. Um, Number four, make others aware of how you're feeling. So actually, some people self-harm to try to communicate what they're dealing with, truthfully. Um, Number five, to distract themselves from their feelings. So they self-harm to stop thinking about what they're feeling. And number six is they to get relief from their feelings. So who if you yourself or someone else has been self-harming, that is not a mental illness or mental health disorder at all as a standalone, because self-harming is a way that you're coping with your feelings and emotions. Most likely people are dealing with anxiety or depression or borderline personality or bipolar, and they are dealing with extreme circumstances of negative experiences or thoughts that occur, irrational thoughts, and they're trying to manage it in a way where they feel better. So sense of relief from those feelings. Now let's talk about four of the six. So one, if you self-harm to manage your feelings, it could be because you're constantly feeling overwhelmed by your feelings and like sadness, hopelessness, guilt, failure. And so you may self-harm um, because you find it difficult to put your feelings into words. So instead, you're just trying to self manage. And a lot of us don't understand how to manage our feelings. So if we get angry, how do we channel that anger? People talk about anger like it's a negative thing, but the reality is that anger is just a form of expression. And the only thing that makes anger negative is the acts and behaviors that you do after. Like if you punch somebody and fight, or you break something, or you um, make a decision that you regret later. That's what makes anger negative, not necessarily the emotion and the feeling of anger, because there's always a reason behind the anger. So, in using anger as an example, people self harm to manage that feeling. So they may intentionally put themselves in emotional or physical harm in order to feel better and manage that. So, one way that you can manage it differently and not self harm is replace the self harming with other strategies and techniques that help you reduce your feelings of anger, as an example, because anger is one of the reasons. And anger is not a standalone either. Anger is a symptom, primarily, mostly, of depression. Um, some people with anxiety can get angry because they're so overwhelmed. But the reality is this, is that mostly it becomes from depression. So either people respond to depression and sadness in a way where they're externalizing anger, like yelling and arguing with somebody else, or they internalize it. And when they internalize their anger, they become mad at themselves, and that's when self-harm can occur. Um, so you're welcome. So the second one is self-harming to communicate. You would think that some people, you know, would be able to communicate if they need something or want something, if life was that simple. I mean, the reality is this: sometimes you go through painful situations that you can't share it with just anybody. And in those particular cases, sometimes self harming helps you communicate that you're in pain, communicate that something bad happened to you. And a lot of times, after a traumatic experience, that's what people do. Now, there's a lot of misconception that self harming is done for attention seeking, and that is not true. It's let's say it's a very minute, very minuscule 1% of people that might do it for attention seeking. It's not a lot. A lot of people are trying to communicate that they're in pain. They're like screaming for help. So pay attention if it's somebody that you love, or if it's you. If it's you, seek help, please. There's a lot of great professionals out there that can really help you get through the pain that you're feeling. Um, and one form of self harm is eating disorders. And I talked about emotional eating last Sunday. And if you haven't seen it, please go on my YouTube channel, Real Talk with Kaisha, and the video is there if you want to watch it. But so eating disorders is a form of self harm, but it can be managed if, one, you have to manage the eating, and then two, you have to address the self-harm behavior by addressing the underlying anxiety, depression, whatever the mental health issue is. Most of the time, like I said, is PTSD, trauma. So if a person uses it as a form of communication, they want to express their feelings. Again, this is about expression of feelings. So the first one was on managing feelings. This one is how to express it and communicate. The third example is to have control. You may self-harm to have control because you feel out of control. You feel like your feelings are overwhelming, your feelings are out of control, and then the only thing you can control is your body and your environment. So you may overdo it in a way where you self-harm, so you can disassociate from what's real, so you don't have to face it. And disassociating means it doesn't mean that you're having a mental breakdown necessarily. It is a part of that, but it's really just detaching yourself, separating yourself from reality, from yourself, from anything that is real. And so self-harm, so for instance, drugs, substance abuse. Um, People say that when you get your first high, that is the best high that you feel. Well, A form of self-harming is using drugs so you can be able to detach yourself from the pain and hurt and disassociate yourself, so people get high to escape, per se. And that's their way of having control. Now, if you have more questions about dissociation, dissociative disorder, self-harming, and drug addiction, you can get information from me or anybody else that provides mental health services. I mean, there's tons of stuff on the internet, but be careful, because you have to make sure that it's a legit um, website, because there's a lot of people that write opinion pieces, and I take pride in the things that I talk about in my lives. So while I actually am sharing my professional opinion, and it's all based off of research and reputable websites, and also material that exists, from anything from the DSM-5 to APA, American Psychological Association. So just be careful the information that you actually look up. So, and the last example is self-harming to punish yourself. You blame yourself because of things that you've done wrong. So you may even feel a sense of self-hatred. Um, and this is actually one of the most common reasons why people self-harm. They get so angry. Remember, I talked about internalizing your anger. So self-harming is tied to responding to different emotions and feelings that you're dealing with, and you either behave in a way where you intentionally harm yourself physically or mentally and emotionally. So in particular, punishing yourself is a way for you to say, okay, I did this wrong, I deserve to be hurt, so I'm gonna hurt myself. That's exactly what punishing yourself. It displaces anger. It's like I said, internalized anger, but it also is a way to feel better, even out the score, because people that actually self-harm to punish yourself, you feel like you should have a consequence for the things you've done. And it could be anything from you failed a college course to you were reprimanded at work, and written up. I mean, some of these things you may think that they're small, but understand there is nothing small that is not important. Like, something that you may think is small may not be small to somebody else. So be careful in thinking like that they shouldn't do that. The biggest problem with self-harming behaviors is that people don't understand it, number one, and family and friends think that it's not a real thing. They're like, you're just anxious or depressed. Just don't worry about it. Get over it. You'll be all right. Just pick yourself up and get over it. It's not that simple. When you feel overwhelmed with depression or anxiety or pain from trauma, you really can't manage it. It doesn't matter if it was one little thing or several things or one major thing. It doesn't matter. It's important enough to you or to your loved one that it's affecting them in a negative way, which is causing them to self-harm. So be mindful of that, because I think that we tend to minimize and not pay attention. And remember, the number one issue with self-harming is people do it in secret. So there may be people that you're really close to, that you might not even realize or know that they are self-harming. So pay attention. That brings me to, if you know somebody, how do you know? You might feel like that you're the only one who's self-harming. You might feel like you're alone in everything. And this is why it's important, if any of you out there are self-harming, please talk to somebody close to you. So what do? The first thing is you want to decide who to talk to about it. It obviously has to be somebody you trust. So the options are this: either somebody you trust, you talk to them, or you talk to a professional that is, you don't even know them, because the reality, they're bound by laws. Like, I'm a licensed therapist, and if somebody comes to me and tells me anything, I'm bound by the law to not share confidential information. Self-harming is the one reason to break that confidentiality. But like I say to my patients, even though I am a mandated reporter, and if there is a danger of you harming yourself or harming someone else, we're supposed to report it. The way I look at it is that I help the person I'm working with so they self-report. Instead of me having to report it, I help them figure out how to communicate those things to their parents or to their loved ones, or to get help, deeper help, because sometimes self-harming becomes so serious that they need to go to a hospital. They need to um, also seek psychiatric treatment, which means to get medication. Um, and and medication is one of those things that you're either comfortable with it or you're not. But the dangers are if you need it and you don't get it. So exactly, I agree with Joseph that the worst thing an individual can do is hide the pain within and through family's teachings. Yes. So that's the pressures of family, is that you don't go to strangers, you don't talk about what's going on in your family. And with self-harming, that adds a whole nother layer, because even without cultural pressures and family pressures, you already feel like not wanting to share that you're in that much pain. So you're absolutely right. That's why if you find a professional that you can share it with, it could be that person can help talk you through what to do next. What can you do to feel better, if that's what you want? Sometimes it's not easy talking about these things. So I grew up, I've said this in past lives, I grew up, in my family, you don't talk about anything with strangers. So I would say to you that for a long time, I was like anti-therapy, anti-mental health support and services growing up my whole life. But I have PTSD myself, and through all my trauma and experiences, the one thing I learned was, in order for you to feel better and really gain control of your life, you need help. You need help. So I finally decided to become a part of the solution, not continue the same cycles of repeating, avoiding getting help. So what can you do? So there are many strategies to help. Depends on what self-harming behaviors you or your loved one are doing, right? So of course, if you're thinking about self-harming but you haven't done it yet, seek help. See a therapist. See a pastor at your church if you're religious. Seek, talk to your best friend who you actually trust, and from there, what I would say to you, self-harming is one of those things that if you really wanted to, you can stop the behaviors, but it's very hard if you've been doing it for a while. So that's why I keep pushing, get help professionally. So one type of therapy that was created specifically for self-harming behaviors and suicide is called DBT, dialectical behavior therapy, and it's a kind of like a spin-off cousin of cognitive behavior therapy. And all it is that it teaches you 4 key areas: mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. Now, what does that mean? There are ways to learn to basically express your emotions and feelings and learn how to self-manage, self-regulate, right? So mindfulness obviously focuses on you being in the present moment, and it focuses on acceptance and attention. People think of mindfulness like yoga, but it's not just yoga. There's mindfulness is just it can be meditation, it could be chanting, it could be prayers, it could be rituals and traditions you create for yourself, but it's a way and a form for you to kind of like center yourself and gain control of your emotions. This stress tolerance is really skills to teach people to tolerate negative emotions. So when bad things happen to you, instead of channeling it through unhealthy ways like self-harming and running away from those emotions, you learn to build your resilience skills so you'll be able to stand up and deal with it in a way where you don't run away or disassociate. So distress tolerance is one of my favorite skills to teach people that have self-harming behaviors, or struggle with managing their emotions. The third one obviously is emotion regulation, and it teaches you the how to decrease the intensity of feelings without acting on them. So like if you have fear and anxiety very high, how do you self-regulate and decrease? Like if you're on a 10, how do you decrease it to a 5 or a 4? So we teach you skills around emotion regulation as an example. That was one. And the last one is interpersonal effectiveness. These are skills that help a person understand their needs in relationships and how to develop ways of dealing with friends and family, because relationships are so important to a person's mental health and well-being. And so learning how to have interpersonal relationships is really important. And yes, I agree, journaling is one form, is a strategy and skill to use under mindfulness, and emotion regulation, because you're able to express yourself in your journals. What I do say is that if you do journaling, one thing I would tell you is if you journal negative emotions, my suggestion, and this is my suggestion, if you have a therapist, go with what your therapist says, but my suggestion is that after you write it, a day or two later, then you shred it or rip up the journal, the pages. And the reason why is that if you keep your negative feelings that you wrote down, one day you're going to decide to read it and you're going to relive all those emotions, or they're going to cause more negative emotions. So, but the reason why journaling is so important is it's a way to express and communicate and dump your negative feelings into the book. Now, I, on the opposite, we could use journaling, positive journaling, to kind of talk about things you're grateful for, talk about things you accomplished, talk about positive messages each day. Those you keep. You keep your positive journal because you can reread that and say, wow, I've accomplished a lot. Sometimes we become so overwhelmed with emotions that we actually don't remember the positive things that we've done. You might sit there and you're feeling depressed or anxious and like feel like a failure, like I'm 40 something years old and I've not accomplished anything in my life. But the positive journaling, if you have a positive journal that you've documented different things you've accomplished, you can look through it and say, yeah, last year I didn't accomplish a lot because we were dealing with COVID, and I did these home projects and I helped this person. So what I would say to you is that journaling can be used, but be careful to not use it in a way where it's going to continue feeding your anxiety and depression emotions. Um, but you can use it in an effective way. And then there's not just written journaling. I also tell my patients sometimes some people don't like to write. Okay, well, do recordings of yourself and your feelings. So, for instance, every cell phone nowadays have like um, recording apps or whatever. You could just record and get your emotions out, and then you could delete it after. So that DBT is definitely one of the ways that you can manage your emotions and self-harming specifically. The interesting, it was originated in the 1990s by Dr. Marsha Linehan, and originally she created it for borderline personality disorder for her patients, and quickly it was used for suicide prevention and reducing self-harming behaviors. But now people use it for all types of different mental health disorders, including ADHD. So if you have problem focusing, and you have ADHD, or if you suspect you have ADHD, using DBT might be helpful. So to wrap it up, what I would say to you is if you yourself have self-harming behaviors, please seek treatment. Um, and there's different forms of treatment that you can receive. Now, you can go to your primary care doctor and just get medication if you're dealing with anxiety or depression. My suggestion is always go to somebody and talk it through, because the biggest part of mental health services is helping an individual really understand themselves better, understand why they feel the way they do, why there's certain emotions that come up for them, and possibly what the triggers and causes are, and working through some of that stuff before you actually decide on the best course of action. And it doesn't help. You can have one consult with a therapist or a psychologist or psychiatrist, and then from there you can remember you are in control of your own self. You don't have to feel pressured to do anything you don't want to do. But if you are having these self-harming behaviors, it's important that you do get some support around it and somebody you trust. And if you don't know if you have somebody you trust that you could share that information with, my suggestion is test them out. Tell them something small and see if they could keep it a secret. So before you tell them something big. But obviously, therapy is the best form of help for self-harming. But if you also want to figure out for yourself and you're a little skeptical about therapists, what you can do is just ask questions. There are plenty of places. There's hotlines. There's 1-800 numbers that you can call. There's also, I think, some websites that you could go on and ask questions directly. If you have any questions for me, you can reach out to me. But self-harming behaviors can be treated and can be you can intervene and change those behaviors, so then you learn healthy ways to actually address any pain or hurt or experiences you've been through. Just know that there are ways to manage it, and there is a lot of help out there. So hopefully this was helpful for you. If you have any questions, please reach out to me in my inbox, or you can go on my website, kvtrainingandconsultation.com. And if not, go on to my YouTube channel, Real Talk with Kaisha, and this video will be up there by tonight. Thank you for joining me, and tomorrow I have Coffee with a Message at 8 a.m. Eastern Time. If not, I'll see you next Sunday here for Real Talk with me. Have a good night. Thank you.